Most of you probably know that the majority of the action of your lungs moving air in and out is controlled by your diaphragm. Your diaphragm is a very muscular structure that separates your chest cavity or your thoracic cavity from your abdominal cavity or your belly. When we look at this, we're going to be dependent on it to help us change pressure. So we're going to have to think like physicists for a few minutes and think about air pressure and what that means. Now, in mammals, we actually look at breathing through your nostrils, and they tell you you're supposed to breathe in and out through your nose. Why? Well, by breathing through your nose, we look at warming the air in your sinuses. We look at filtering the air. You have hair in your nose. You don't have to be an old person to have hair in your nose. And we're going to humidify the air, also in your sinuses. So we're going to add moisture, we're going to warm it up, and we're going to filter it out. Well, what are we filtering? Filtering dust, things like that. Okay. And on top of all of that, that's just for getting it into your lungs. We also want to think about odors. So by breathing in through your nose, you're actually sniffing the environment, right? And smelling. Preferably for good things, but sometimes for bad things. So if we move from your nose into your lungs, this is the path we take. Breathe in through your nose. Big sniff in. Where does that air go? It goes into your pharynx, which is also known as your throat. So it's actually coming down into your mouth, right? But the whole idea of bringing it in through your nose is it's going to pass by your sinuses. You're going to be able to take in and moisturize and warm that air before it goes into your lungs, because the air in the room or outside can be cold, right? We want to warm up that air before it goes in and freezes your lung tissue. That's not good. We also want to filter it, right? Let those hairs in your nose do their job. Filter out the dust and the pollen and the particles and the dander from your dog and whatever else. Then we move into your larynx, which are your vocal cords. You can sort of feel this right below your chin on the front of your neck. It's kind of an enlarged, sort of hard part. On some males, we see this very enlarged and sticking out a little bit, protruding a little bit. Then we move down into your trachea. You've heard trachea. This is the cartilage rings. If you feel down the front of your throat, you can feel the lumps from those cartilage rings on your trachea. And then we branch off into our bronchi. Bronchioles, when you see O-L-E-S, that just means a smaller version. So in this case, looking at tinier bronchioles. Okay, so bronchioles are tinier, smaller in diameter. And then we get into alveoli. I mentioned this to you before, as this is where your large surface area is associated with your lungs. In through your nose, down through your pharynx, and into your larynx, your voice box, and then down into your trachea, and then into the bronchioles. You have two lungs, so it breaks off, goes both directions. And then we get into the bronchioles from the bronchi. And then at the end of those, at the end of the bronchioles, we've got these clusters of alveoli. So some people say they look like grapes. The idea here is they are completely covered in capillaries. Capillaries are your smallest blood vessels. And we'll see those more in your cardiovascular system, but for now we need to think about them as being very, very small and exchanging oxygen and carbon dioxide. Not only at the alveoli, but they will be also responsible for exchanging oxygen and carbon dioxide at your tissues themselves. Your heart sits in between your lungs. And the diaphragm, that muscular structure we were talking about, is this dome right here. We are dependent, as I said, on those alveoli for diffusion. Remember, again, red is oxygen rich, blue is oxygen poor, and purple is a mix. The alveoli are very, very thin, and they're moist. We have to keep them this way so that we can get the best exchange of oxygen and carbon dioxide that we can. We're looking at diffusing oxygen into the blood. So here's a cross-section of a bronchiole coming down, and then all of the alveoli, or the smaller pockets. Okay? And we're looking at exchanging across those walls, membranes of the alveoli, exchanging oxygen and carbon dioxide. So we want those oxygen molecules to diffuse into the blood. We want the CO2 molecules to diffuse out of the blood so that we can get good exchange in our lungs and actually look at how this will impact the cells as long as we keep this exchange going on. We said that everything has to stay moist. We actually produce something known as surfactants, or secretions, that are going to help keep the alveoli opened up and not sticking shut. This is really, really important. As an adult, we don't think about this too much. It doesn't impact us a lot because we're good at producing these surfactants. We're good at these secretions. Folks that have trouble with them tend to be smokers, tend to be individuals that are exposed to a lot of air pollutants. Sometimes if you decrease this surfactant production, or if the surfactants just aren't good enough to keep up, you're going to lead into all kinds of respiratory diseases and illnesses. You can also be born with surfactant issues. So respiratory distress syndrome is actually in infants and typically in premature birthed infants. Looking at the amount of lung surfactant as being inadequate, essentially their lungs are sticking shut in the alveoli. So if the alveoli stick shut, you can't get oxygen, you can't get air in there to exchange the oxygen and the carbon dioxide. Now we actually can use artificial surfactants, things that are manufactured, to help these infants get off to a better start. We do look long term at all kinds of issues affecting our lungs over our lifetimes, lung pollutants as far as air pollution, tobacco smoke, and so on. We also look at things like COPD, or chronic obstructive pulmonary disease, always associated with these kinds of lung pollutants that actually are going to limit ventilation and gas exchange, make it very, very, very difficult to breathe.